Well, now, as authorities around the world scramble to learn more about the new Omicron variant, the South African doctor who first raised the alarm has described the symptoms as unusual but mild.
Yeah, Dr. Angelique Coetzee joins us now from Pretoria in South Africa. Dr. Coetzee, good to see you. So, when did you first realise that this was going to be a different strain of COVID?
Good evening from South Africa. I realised on the 18th of November when I saw the first case of a young man presenting with extreme fatigue for 2 days, body aches and pain and a slight headache, that this symptoms does not fit in with a young man that very seldom would visit surgery. He also made an appointment for the rest of his family that morning. And because the symptoms is very similar to a viral infection, we tested him and he tested positive, and the rest of the family also tested positive. We sent them home with conservative measurements because they were not really very clinically ill. And after I saw that family, there were 7 more other people. It's like a light switch that's been switched on. All of a sudden, you haven't seen COVID patients coming in for between 8 to 10 weeks, and then all of a sudden you see them coming in. So because I am on the advisory committee of the ministerial vaccine team, I alerted my team and said, listen, I have seen patients this morning with asymptomatical symptoms, not the same than Delta. No loss of smell, no loss of taste, no stuffy nose, no cough, no fever, very little fever. I saw in this whole 10 days with only 2 patients with fever. So, and also their oxygen saturation was normal. And that's it. That's what we saw. And they then only on Monday confirmed, after the labs in Pretoria also pick up an unusual PCR testing. And on Monday it was confirmed it's the new variant. It's not only me that are seeing these symptoms, it's some of my other colleagues in the Pretoria Midrand area. And so far, patients quite mild disease. We have easily treated them at home and no complications up until now. They're all healthy. Some of them are going back to work tomorrow.
Okay, so you're saying that generally we're seeing less severe symptoms with the Omicron variant. What have you observed so far in terms of how infectious it is compared to previous strains, and also how vaccines are responding to it?
So for what we are, looking at the numbers, tonight we have a 9.8% infectivity rate. Again, about 1 in 6 people that has been tested today in the Gauteng region has tested positive. So, it might be quite infectious. It might be the same with the same type of infectiousness as the Delta variant. But the severity that we have currently seen are not so severe. Yes, it's early days. It's only tomorrow, day 12. So it might be that there would be more severe cases coming through. Patients that has been vaccinated, we have seen a few of them. Again, a mild disease, and we are not aware, under the GPs that I have, with whom I have spoken today, that any of them have admitted any patients to the hospital. I also spoke to some of the hospitals in Pretoria. Again, there is about 1 or 2 patients that have been admitted. Can't tell us whether it's Omicron or Delta. And the same in the public sector hospital, Steve Pico. Also, admission rate is of more of children than adults, and most of the adults that they are seeing are only being picked up asymptomatic when they screen them for hospital admission for other reasons.
All right. Well, Dr. Coetzee, thank you so much for your time. We will leave it there, but we really do appreciate it.
Cabinet meeting within the next 48 hours to discuss the new COVID variant. 2 cases of Omicron have been detected in New South Wales, and testing is now underway to determine if a potential 3rd case travelled to Victoria. But Scott Morrison says we shouldn't panic.
Well, it's obviously a variant of concern, but it's not the first one we've had. We've had 13 variants of concern over the course of the pandemic, 13 variants, I should say. And I think what's important is we stay calm. We know it could be more transmissible, but we also know that it's proving to be less severe. And so we just take this one step at a time, get the best information, make calm, sensible decisions.
Live now to our team of reporters. First, Sarah Stewart at Sydney Airport. Sarah, the Premier has just given an update.
He certainly has, Sylvia. Just a few moments ago, he described that 141 people on 5 flights have arrived from the affected countries in the past 24 hours. He's confirmed that all 141 are now in hotel quarantine. Now, he says he's spoken to the Prime Minister. He's also spoken to the Premier of Victoria, but he says at the moment there is no need to change and business is continuing as usual. Here he is.
We don't just need to learn to live alongside COVID, we need to learn to live alongside the variants as well. We're very confident based on our high vaccination rate. I said yesterday and I'll say it again, vaccination is key to New South Wales being able to continue to open up safely.
He also confirmed that the numbers are staying the same at the moment, that there are 2 infected cases, possibly a third. But also we know that there are 260 people that have been identified as close contacts of those people. They are all now in isolation in homes across New South Wales as well. New South Wales Health staying in contact with them and obviously testing them as well. Sylvia?
Sarah, thank you.
Let's go now to today's Christina Hearn at Melbourne Airport. Chris, Victorian health authorities there are on alert.
David, health authorities confirmed last night that there was a case from Southern Africa that arrived in Australia recently and they travelled from New South Wales to Victoria. They have tested positive. Now, it is not clear at this stage whether they have Omicron. That, of course, is still being investigated, but certainly everyone in Victoria is on alert. There are currently 40 people in Victoria that have recently arrived from Southern Africa. None of them at this stage have tested positive. Of course, all eyes are on hotel quarantine. And those requirements. It did change over the weekend. Anyone arriving from those countries of concern now do have to go into 14 days of quarantine. All other international arrivals must quarantine at home for 72 hours. But there are reports this morning that potentially health officials could look to extend that to 14 days of quarantine for all international arrivals. But the World Health Organization has told Today on 9, just like what the PM said, there's no need to panic.
We ask countries to really look at their risk, to look at what science is saying for them. And if a country does take a decision to close its borders, to do that for a short while and use the time well.
Masks could also be reintroduced to more settings as we fight yet another strain.
All right, thanks for that, Chris.
There are fears Queensland's border could remain shut as the state reacts to this new variant. Today's Mia Glover is at Brisbane Airport. Mia, authorities there taking no chances.
Yeah, they're not, Tim. Good morning to you. At this stage, they're staying cautious, not yet alarmed. Fortress Queensland is set to reopen on December 17 to fully vaccinated Australians, or whenever we hit that 80% double dose mark here in the state. It would mean no one would have to quarantine when they arrived here, so long as they're fully vaccinated and test negative to COVID. But the acting chief health officer said that could change in light of this new variant coming to hand. He said he refused, Tim, to rule out quarantine changes, to keep the quarantine rules in place as they are for interstate travellers who arrive from New South Wales and Queensland, even after the border does reopen. That would mean so many Christmas holiday plans, reunions for families could be in jeopardy if people have to spend 2 weeks in a hotel or quarantine at home. But Graham Screw-Turner, the boss of Flight Centre, has weighed into all of this. He said, like the PM has said, and also the WHO has said this morning, there's no need to panic.
These variants are going to happen. They're going to happen every few months, every 6 months, every year. So we just got to learn to live with it and move on and keep the plans open. But this is going to disrupt things in the short term.
Tim, there's currently 10 travellers right now in hotel quarantine here in Queensland who have all arrived from 9 southern African countries. All of them have so far tested negative to COVID, but they will be retested over the coming days to see if they have brought that new variant into Queensland.
Mia, thank you.
Prime Minister Scott Morrison says Australians shouldn't panic as he calls a national cabinet meeting. Nine federal politics reporter Fiona Willan is in Canberra. Fee, keep calm and carry on. That's the main message, right?
So that is the key message from Scott Morrison. He says he'll meet with state leaders within the next 48 hours to work out the next steps. He says it's very early days when it comes to knowing about this variant and its severity. The Prime Minister was asked about the possibility of Australia suspending all international arrivals, and he said we should never rule anything out, but he also cautioned against reading anything into that remark, saying the leaders will make their decisions based on expert medical advice. This is a bit of what he had to say on the show.
It's just important we remain calm about this. There's no evidence to suggest that this leads to any more severe disease. If anything, it's suggesting a lesser form of disease, particularly for those who are vaccinated.
Now, some health experts have been calling for booster shots to be brought forward. The Prime Minister says the government isn't considering doing that because it's not the medical advice. Sylvia?
Fee, thank you.
The South African doctor who sounded the alarm about this new COVID variant says Omicron's symptoms are less severe than the Delta strain. She joined us on Today on 9 a little earlier.
I alerted my team and said, listen, I have seen patients this morning with asymptomatical symptoms, not the same than Delta. No loss of smell, no loss of taste, no stuffy nose, no cough, no fever. So far, patients quite mild disease. We have easily treated them at home and no complications up until now. They're all healthy. Some of them are going back to work tomorrow.
That is some good news. Well, there have been no deaths linked to Omicron and it has not yet caused mass hospitalisations, but experts are still trying to determine whether it is resistant to vaccines. Breaking news at 9, Victoria has recorded 1,007 new cases of COVID-19. 3 people have died within the past 24 hours.